Let's now discuss stomach cold. This will be an acute pattern resulting from climatic, dietary, or pharmaceutical influences. This is a pattern of interior full cold. It is an acute pattern caused by the invasion of the stomach by exterior cold. The stomach is one of three organs with intestines and uterus that can be attacked by exterior cold directly by passing the exterior layers of the body. Exterior cold blocks the stomach and prevents stomach chi from descending, hence the vomiting and the pain. Cold impairs the yang of the stomach and spleen and prevents the food essences from reaching the body, hence the feeling of cold, slow pulse, preference for warm liquids, and aggravation from cold liquids. Stomach cold is due to a cold pathogen invading the stomach and manifests as cold pain in the epigastrium with excess cold symptoms. It is also called cold invading the stomach. Key symptoms: presence of epigastric pain and cold patterns at the same time. Clinical manifestation: sudden epigastric pain, which is aggravated by cold and alleviated by warmth. Nausea, vomiting, pain, which is relieved temporarily after vomiting, a bland taste in the mouth and lack of thirst, or clear drooling, which is excess salivation. Pale or blue complexion, cold limbs, a pale tongue with a white moist and slippery coating, and a wiry or deep, slow, and tight pulse. This pattern is mostly ascribed to an excessive intake of raw and cold food, or an attack on the stomach by cold, which leads to cold stagnation in the epigastrium. Exogenous cold can invade the stomach, either via the mouth or through the skin of the abdomen. If the invasion takes place through the mouth, it will be due to the consumption of food that is a very cold temperature or energy. This could, for example, be ice cream, ice water, or other cold beverages, but it could also be due to the consumption of drugs or herbs that have a very cold energy. Invasions of cold via the skin will be due to contact with cold climatic influences, particularly if the abdomen is cooled down by wearing wet clothes. So please note that the clinical manifestations we have just described is the acute stage of an invasion of cold in the stomach. If the cold is not expelled and we see the patient a few weeks or months after the initial invasion, the symptoms will be characterized by empty cold. In this case, the epigastric pain is less intense, the tongue coating less thick, and the pulse less full. As cold injures yang, if the situation persists, the stomach will suffer from empty cold and yang deficiency. That is the pattern of stomach deficient and cold. Therefore, the present pattern of cold invading the stomach may lead to stomach deficient and cold. Etiology for cold invading the stomach is invasion of exterior cold, exposure to cold, excessive consumption of cold or raw foods. Underlying or accompanying pathology, possible underlying stomach chi weakness. Signs and symptoms: sudden severe epigastric pain, feeling cold, preference for warmth, cold limbs, nausea and vomiting of clear fluids that relieves pain, pain worse after drinking cold fluids, preference for warm liquids. Pulse, deep, tight, and slow. Tongue, thick, white coating. Treatment principle: scatter cold, warm, and harmonize the stomach, stop pain. Acupuncture treatment: stomach 21 to dissipate stomach cold, REN 13 to stimulate descending of stomach chi, stomach 36, main point to supplement stomach chi, stomach 44 to descend the stomach chi, pericardium 6 to harmonize the stomach, spleen 4 to clear obstruction from stomach, stomach 34 for acute and painful patterns, REN 12 to supplement stomach and spleen chi, stomach 21 to regulate chi and alleviate pain. We needle with even method and moxa. When there is an invasion of cold in the stomach, the person will benefit from eating and drinking food and beverages that have a warming and spicy dynamic and that are thermally hot, such as ginger tea. If the invasion is due to climatic influences or wet clothes, a ginger poultice on the abdomen can help to expel the cold. The person should avoid consuming food and beverages that are cold in their temperature and energy. The upper abdomen should be kept warm and dry.